As individuals age, their sex hormone levels, such as testosterone and estrogen, tend to naturally decrease. While it's important to note that aging is a natural process, and these hormone levels will decline over time, there are some lifestyle changes and medical interventions that may help boost sex hormones in older adults. However, it's essential to consult with a healthcare professional before making any significant changes to your hormone levels, as excessive or inappropriate hormone supplementation can have risks and side effects. Here are some strategies that may help increase sex hormones in old age. 1. Hormone replacement therapy, HRT, for men. Testosterone replacement therapy can be prescribed by a doctor if a man has clinically low testosterone levels, a condition called hypogonadism. HRT can be administered through gels, patches, injections, or implants. For women, hormone replacement therapy, HRT, with estrogen and progesterone can be used to relieve symptoms of menopause and increase sex hormones. However, HRT carries some risks, so it should only be used under a doctor's supervision and for specific indications. 2. Maintain a healthy weight. Obesity is associated with lower testosterone levels in men and disrupted hormone balance in women. Losing excess weight through a balanced diet and regular exercise may help increase sex hormone levels. 3. Exercise regularly. Engaging in regular physical activity, including resistance training and aerobic exercise, can help boost testosterone levels in men and improve hormone balance in women. 4. Diet and nutrition. Consume a diet rich in nutrients that support hormone production, such as zinc, vitamin D, and omega-3 fatty acids. Foods like lean meats, fish, eggs, nuts, and leafy greens can be beneficial. 5. Manage stress. Chronic stress can lead to elevated levels of cortisol, a stress hormone that can interfere with sex hormone production. Practice stress reduction techniques such as meditation, yoga, or mindfulness to help balance hormone levels. 6. Get adequate sleep. Quality sleep is essential for hormone regulation. Aim for 7 to 9 hours of uninterrupted sleep per night to support healthy hormone production. 7. Avoid excessive alcohol and tobacco use. Excessive alcohol consumption and smoking can negatively impact hormone levels. Reducing or eliminating these habits may have a positive effect on sex hormones. 8. Stay hydrated. Dehydration can affect hormone production and overall health. Ensure you are adequately hydrated by drinking enough water throughout the day. 9. Consider natural supplements. Some natural supplements, such as fenugreek, ashwagandha, and maca root, are claimed to support healthy sex hormone levels. However, their effectiveness can vary, and it's essential to consult a healthcare provider before using supplements. 10. Regular health checkups. Regular checkups with your healthcare provider can help monitor your hormone levels and identify any underlying health issues that may affect them. Remember that hormone levels are highly individual, and what works for one person may not work for another. It's crucial to discuss your specific situation and concerns with a healthcare provider who can provide personalized recommendations and monitor your progress. Additionally, the goal should be to achieve a healthy hormone balance rather than excessive levels, as imbalances can also lead to health problems.